Welcome back. If you're watching this, you're ready to move from the ideas first innovation used by beginners, and we're going to dig into the empathy first approach. You've seen how starting with empathy can lead to better outcomes, but there's another challenge we need to address. Many nurse leaders struggle to envision what this transformation truly looks like. How do abstract concepts like empathy translate into tangible improvements in patient care? So it's easy to get stuck in the day-to-day grind, to feel like your efforts are just a drop in the bucket. And you might be wondering, can I really make a difference? And this doubt and uncertainty can hold you back. But what if you could see firsthand how small changes in your approach can lead to massive improvements over time? So if we haven't met before, I'm Ty Hagler, and I've dedicated my career to developing better systems of innovation in healthcare by really helping frontline workers lead the innovation process. And I've coached countless medical innovators to advance their new idea, their program, their initiative through applying the principles of design thinking. And the team at Trig, where I work, has worked on hundreds of new products, and some of which have become commercial successes and have won prestigious design awards. Today, what I want to share with you is a story from one of our healthcare teams that has made a big impact. Let's meet the Smooth Transitions team from the Department of Hematology at UNC Health. Team Smooth Transitions took our design thinking course in partnership with the Fast Tracks program at UNC. The pediatricians and adult hematologists had identified a significant problem of transitions of care for adolescent young adults who have sickle cell disease, which is a chronic disease that requires ongoing care and pain management. So for context, when I left home to go to college and I had to manage my own healthcare, I didn't see a dentist for years. And the downside for me was several cavities, but otherwise wasn't catastrophic. The downside for an adolescent with a chronic disease who is just learning to take responsibility for their care, where before they had their caregiver help them or their parent or significant other, is that when they miss those appointments, they have a rapid deterioration of the managing their symptoms and an unpleasant visit to the ER. And the rate of mortality for young adults with sickle cell is markedly high during this time. And the Smooth Transitions team was motivated to solve it. So during the Med Design Applied Design Thinking course, the team of doctors and nurses and social workers quickly discovered how complex this problem can be. Each stakeholder had a different take on the unmet needs for transitions of care. Building a journey map of the steps in this process took much more time than anticipated. We actually had 2 separate attempts at this, just because it was so challenging to pull together these different perspectives and to try to find alignment on them. Through the twists and turns of discovering new solutions, the team had developed 3 promising concepts to address the problem. One was a digital health solution, the other was a physical artifact, and the third was a change in the standard of care. And so what was really cool was just last week, the leaders of this program, Dr. Jane Little and Caroline Hale, recently shared with me their excitement after having launched their first successful event that was envisioned during the Med Design course. And so this change in the standard of care didn't require significant investment, just intentional design and dedication to better patient care. Because not every innovation leads to a billion-dollar company, nor does it need to. As you saw with Team Smooth Transitions, innovation can set patients up to live happier, healthier lives through a program that was empathetically designed for them. The value behind this sort of impact is invaluable to people who are living in such a harsh disease state. Now, hopefully you can see that small incremental changes driven by empathy can have a ripple effect from the organizational level down to the patient level. Sometimes you need to discover the power of taking a step back, understanding the needs of everyone involved, and co-creating solutions that truly work. Every healthcare setting is unique, but the principles of empathy-first innovation are universal and particularly applicable to complex settings. So I'm going to show you how to adapt these tools and techniques to your specific challenges. And this observation is that insights are all around you. I'll share a simple exercise here to help you uncover hidden opportunities for innovation in your daily work, which is called cross-pollination. So the cross-pollinator is someone who finds a successful innovation in one industry and simply take what works in one domain and applies it to the other. Think of it as like an import-export business. By putting yourself in the shoes of someone in a different industry, you might see the problem you're facing through a new lens. For example, if you're dealing with a problem with, say, central lines and vascular access, you might step back and ask how a plumber or an oil company that has pioneered fracking techniques might approach the problem. It's a completely different context and way of looking at it, but perhaps there's solutions that you can cross-pollinate from one industry to the other at different scales, at different regulatory environments, but perhaps you can find new insights to power a new breakthrough approach to solve a significant problem. So as a Star Wars nerd, I'll also reference George Lucas, who famously had the insight to pull from Joseph Campbell's hero's journey in the book, A Hero with a Thousand Faces, that archetype to write Star Wars. And that fundamental structure that pulls from thousands of stories that all build on the same themes, by pulling from the best of each of those different stories that have been told throughout human history, George Lucas made it impossible for the knockoff films that tried to replicate his success from really understanding that hidden formula that made for a successful story and launched a franchise. Okay, so hopefully you can see how that willingness to go outside of healthcare to find answers to your problems can be the key insight that can power new discovery, new programs for the problems you're facing. My next video, I'll show you how to take these empathetic insights and turn them into concrete actions. You'll learn how to generate a wealth of new ideas without the inhibition of judgment from your peers. It's something we call psychological safety and also production blocking. This is where the magic happens, when empathy-driven innovation becomes a tangible reality. You'll see how to build a culture of innovation within your team where everyone feels empowered to contribute your unique perspective and ideas. So don't miss out on this opportunity to take your innovation journey to the next level. I'll also be sharing a special limited time offer you won't want to miss. Subscribe to our channel, hit the notification bell so you won't miss it. In the meantime, share your thoughts and experiences in the comments below. Let's build a community of nurse leaders committed to transforming healthcare through empathy. Thank you.